So at Oklahoma Children's Hospital in the NICU, we have mostly semi-private rooms, which means there are 2 patients per room. Most of our nursing assignments is dependent on acuity, but many of them are either 2 patients to 1 nurse. Some are 1 patient to 1 nurse, and then the ones that are closer to going home, those patients may be 3 patients to 1 nurse, but it's very dependent on the needs of the patients and their acuity, or what actually is the workload for the nurse, and we're always looking at that. Because we're in semi-private rooms, we're also very cognizant to make sure that their assignments are close, that they're not at opposite ends of a hallway. You're not going to see like you would maybe in a surgical unit where they have a patient at the very beginning and very end of the hall. They're going to be very close together, and you have team members and partners that are there to support you whenever you do need that extra set of hands. At Oklahoma Children's Hospital in the NICU, we are very unique compared to other NICUs in the state because we are the only academic NICU and we're a level 4. What that means is we have every type of NICU patient, from the ones that are born early that might have just regular neonatal challenges to those that have special needs, either cardiac anomalies, other metabolic or medical needs. We are the referral for all of these other hospitals, and so you're going to be able to challenge yourself as a nurse to see every type of neonatal patient, from a surgical to a medical, and then choose even maybe a certain population that you prefer as you go down that path of your career to have additional education to specialize in different patient populations as well. So although you can work in other NICUs and take care of neonatal patients, here at Oklahoma Children's Hospital, you're going to take care of the entire span of neonatal patients.
The reason I chose to be a NICU nurse, I've always been enticed by babies. I love taking care of babies. When I was in nursing school and we did our rotations, children always called me. That was my passion. The reason I chose Oklahoma Children's Hospital is because this is the top-notch, the level 4 training that we have here. You can be a brand new student and have all of the specialty trainings. You can always advance in everything that you do here. There are many instances where a child requires more attention, and it's not a sink or swim situation. You will always have your physicians, your respiratory therapists, your coworkers, your colleagues, chaplains that are there to support you and help you. We have really rough days and then we have amazing days, but it takes a teamwork, and that's what we are. We are a team, and we work very hard to give the babies the best chance in life.
So Oklahoma Children's Hospital is very unique in the fact that we are the only freestanding children's hospital here in Oklahoma. We also get to take care of those patients that nobody else takes care of here. So specifically in the neonatal ICU, we do our ECMO patients, and then our cardiovascular patients that we take care of here with the link to our specific cardiovascular unit. So those babies will start in our NICU and then kind of go maybe to the CVICU as needed. And that's a really specific program that we have that makes us really special. So we're getting babies from all over the state, and then even some babies who are outside of our state that come in for that. Yeah, so whenever we first meet these babies, we know that we're seeing them not at their ideal, right? Maybe they're too little or they're too sick. And it's really rewarding whenever we get to see those families come back and get to see them. Maybe those babies that we weren't ever sure were gonna make it are now walking down the hallway to get to meet us, or we're getting to see them do a follow-up at our premier clinic. And we get to see the milestones that they're making, that we helped them to get there. And so we not only helped the babies by doing the medical intervention, but we helped the families get there with the social support that we provide as nurses in the NICU, with the educational support that we provided for those families in the NICU. And so it's really a well-rounded support that our nurses do that we then get to see represented back to us in those families and those patients whenever we see them toddling down the hallway to come and greet us.